Ladies and gentlemen, it is time for another conversation from the couch. And today I have another of our presenters who will be with us at our live conference in October in Seattle. Very exciting to be not online this year. I have the pleasure of welcoming Dr. David Fawcett. David, a warm welcome to you.
Thank you so much. Such a pleasure to be here.
It's lovely to have you, David. You're going to be speaking. I can now tell you exactly when you're going to be speaking because we've even managed to get the schedule up on the website now. You're
Okay.
12:15 on the Saturday. Did you know that?
I did not yet. Okay, cool.
There we go. So you can add that to your
often have to live a day at a time. So this seems very far away, but I know it'll be here before we know it. So.
Good for you. I try to live one day at a time as well. That's part of my recovery.
Me too.
David, I've got 4 questions to ask you today, just so you can give our audience a snapshot look into what you're going to be talking about in October. So without further ado, your title of your presentation, I've got it on my left-hand screen here, is Craving Intensity, Stimulants, Sex, and the Search for Connection, something I've definitely searched for a lot of my life. So tell us all about your presentation.
Right. So a lot of my work has been done with basically co-occurring sex addiction and substance use, particularly amphetamines. And so for many years, I did a lot of work with gay men, for example, with methamphetamine and sexual acting out. But of course, it's not just a phenomenon of gay men. We call it Chem Sex, which actually stemmed from the UK, that my friend David Stewart over there had coined the term, but it's not a gay phenomenon. And so what I am really exploring in greater depth is the idea that these are really super stimulant addictions, and that sex and porn, of course, creates this intensity that people often confuse with intimacy, but it's that intensity they're kind of seeking. And when you add cocaine or methamphetamine or other kinds of drugs to the mix, it just creates this even more combustible combination of things that can really drive up the super stimulating effects, the need for intensity, and this escalating, ever increasing kind of sexual behavior. And what I found basically over the years is that really derives from people, one, often almost always having some kind of trauma, and that the addiction, as we know, is a way to numb that experience, but also there's this, it's not just a numbing sensation, but this need for kind of connection and some sense of feeling. And I think when we see people combining drugs and sex in this way, it's this kind of chasing after this need for feeling kind of alive, feeling connected, feeling like they belong. And many of the men and women I treat with this confuse, as I've said, intensity and intimacy, and they kind of really desperately long for that sense of connection. And some will say they experience it, but I call it more of a chemical connection, and maybe put the word in air quotes, which they don't like, but I think it's really not quite intimacy as a sex therapist or someone with expertise in this field would identify as a true, authentic connection with empathy and feelings and all the other things that go with it. It's a very different animal.
I'm hearing you so loud and clear, because I'm a sex addict in recovery, David, and so I've been in recovery since the 14th of June 2004, and it's been a rocky road, and the last 4 years in particular have been the best, because I think I fell down pretty hard again 4 years ago. Now I think I've finally really got it, and I'm 53. I've spent decades mistaking intimacy for intensity, and thinking intensity was intimacy, and therefore not being satisfied unless it was crazily intense. So I herald your presentation. It's so necessary. The connection to self, intimacy with self, it's got to start there. At least
exactly.
That's I believe.
Exactly. Yeah.
It's beautiful. Thank you.
The other thing we see, by the way, when we combine, there's this wonderful expression in neuroscience called "what fires together wires together." And when I take cocaine and when I act out sexually repeatedly at the same time over and over again, my brain efficiently wires those things together. And so it becomes this whole kind of entangled ritual of different behaviors that, and very often, one of my frustrations with the addiction field in general, especially the substance use portion of that, is that they'll say, well, let's get you clean and sober and the sex will take care of itself. And of course, we know that doesn't happen. And it's like whack-a-mole with different addictive behaviors. So I think seems like such a logical approach to me, but it's news to some people. So I really kind of want to shout from the rooftops a little bit about how that works and what I've seen with that.
Keep shouting, keep screaming. David, when I went to this treatment, my first treatment center started on the 7th of July, 2004, after 3 very rocky weeks. And back then, the emphasis was on abstinence, which to some degree is great with chemicals, but with the behavioral addictions, it's not quite that simple, because to live a healthy life, you have to work, you have to eat, you have to have sex. You don't have to gamble, but you have to do most behaviors that can become addictions. You have to do them.
Yeah.
So absolutely, I so get that, and So thank you for I'm looking forward to your presentation enormously.
Good.
Let me ask you, I get it, but for people that might not see the obvious link, why is this topic so important to sexual health?
Well, I think for all kind of the obvious reasons, and maybe some that aren't so obvious, right? I think a lot of our clients are really genuinely looking for that emotional connection, but kind of looking in all the wrong ways. And so really that confusion we spoke of between intensity and intimacy, but also I think just until we really address all the kind of potential addictive behaviors, well, I'll take a step back. My approach really is that all these different addictive behaviors, whether they're drugs or behaviors themselves, are all representative of this underlying addiction syndrome, if you will, usually based in trauma, right? And I think if we as professionals don't scan the whole set of symptoms, is kind of like a whack-a-mole, right? We'll get this thing under control and it pops out over there, and get that under control, it pops out over here. We're just treating the symptoms as opposed to really addressing what's underneath. And so I think until we can really help our clients kind of understand the bigger picture, and part of what the takeaway from my workshop is going to be some sort of practical tools for the counselor. But until we can help them do that, I think that sexual health issue is going to be really less than ideal, if not impaired. And I think, and what I see typically, my client profiles, these guys or women in some cases that go through these patterns of kind of bouncing along the bottom, right? They'll get some time together and then kind of try to hold together some behaviors, and then something pops out and it all kind of crashes and they start over, and just continuing that forever. And so I think really to really get to clear and satisfying and meaningful sexual health, I think is really means putting all those behaviors, at least addressing them all, and starting to work on that core issue. And I think you said initially, but this one of the key tasks, I think, is for us to create a relationship with ourselves, right? We're always looking for other people or other drugs or behaviors to complete us, which is not an ideal recipe for a successful relationship, I think, if we do that. So
I went seeking intimacy and intensity with other people long before I even considered the beauty in finding a relationship with myself. It's taken almost half a century to figure that one out.
Well, yeah, and in my own recovery too, that was like, I didn't even know what people were talking about when you said that. It was an alien concept. Right.
And of course, the old saying, how can you love somebody else until you love yourself? I mean, for years, I would spit that out and thought that it sounded good, but I didn't really understand what it meant. And of course, if you want to replace the word love with know yourself, fine, doesn't really matter. But yeah, just get to know the person that's causing all the problems.
Right. And also, we talk a lot about those kind of core beliefs that are common among sex addicts, and they're absolutely the same for chem sex addicts, if you will, and just that, I'm unlovable, unworthy. The phrase I've heard for the last 20 years, from a lot of my gay clients are, I feel like damaged goods. That just captures that sense of like shame. And so until we can really start to work on that and change people's perceptions of who they are, and I think there's a lot of forgiveness and compassion, right, for those parts of ourselves that have been hurt way back when. I think until we can do some of that healing, it's really hard to not try to seek the connection or the intimacy in ways that aren't very adaptive.
Beautiful. And to me, a huge part of that was finally realizing that I am a hurt person,
exactly,
not a bad person.
Yep.
And that was a huge transition for me because I just saw myself as an a-hole for many, many years and a very bad person. And I thought myself such a bad person that I almost took my life twice because I hated myself that much. And I'm happy to say today, I'm a hurt person, but I don't have to let myself be hurt anymore. And it's an amazing, liberating transition that people like you and myself and my own work with men help men to realize that they don't have to see themselves as bad. But it's a tough transition.
Yeah, yeah, because that's a lifetime of programming, if you will, and we have to undo all that.
Yeah. You work with the wonderful Rob Weiss, which you told me about just before we came on camera, and someone I've got to know well with huge respect. And I remember him. One of the first things out of his mouth that caught my ear, and this is when I was early training 7-8 years ago, was his attention to the why and not placing all our energy on the what. If we can figure out the why, the what will either fade away anyway or become at least understood. So we're empowered to make active choices if we understand why we're doing it. So that's his philosophy, which I've carried to my heart ever since.
Yeah. Rob and I met each other about 5 years ago. We were both put together on a pre-conference day-long workshop, and he presented his work on sex addiction. I presented my work on co-occurring or sexualized drug use, let's say, the co-occurring piece. And we were stunned at how overlapping our work was, right? Because I always considered my little niche quite separate. And so we co-created this program, Seeking Integrity in LA, where we mixed together in a residential treatment setting, sex addiction, porn addiction, and Chem Sex, sexualized drug use, and it fits beautifully because we do this model of kind of looking not just at the behavior or the symptoms, but what is going on, what's in common with all that. So yeah,
I'll share a lovely quote with you, which I've shared with many people. It's from Desmond Tutu, and he said, "We have to stop just pulling people out of the river. We have to go upstream and figure out why they're falling in the first place."
That's perfect.
Absolutely,
totally perfect.
That just, when I first read that, it just nailed it for me. It's a very beautiful saying.
Lovely, love that.
David, what would you like participants of this, what I have no doubt will be a fascinating hour and a half, what would you like them to take away from your presentation?
A couple of things. I think the kind of conceptual model I'm talking about, where we look at the intensity kind of side of that limbic system spectrum, and with the sex and the porn and amphetamines and gambling and all those kind of behaviors that cluster together. I think it's really important to, I had a mentor once who said, clinicians find what they're trained to look for, right? I think a lot of us, at least in the States, that we have a substance abuse track, we have a sex addiction track, we have a mental health track, but oftentimes people don't have kind of cross training to identify all the different areas, so they miss things. And I think just to kind of conceptually to have people kind of see, at least share my view of how they all fit together, but more than that, just specific skills that I found useful for clients, things like specific affect regulation, or some of the ways to manage some of these really strong triggers and cravings, which from these super stimulants are really, I call them kind of little landmines in our head. I've had clients who are meth addicts or porn and sex addicts who have a good bit of time, and for whatever reason they get triggered, and they weren't even out looking for, they were working their program, but that one flash second trigger can reawaken the whole thing, right? And so I think that the strength of those cravings and triggers is kind of off the charts compared to what some traditional sex addiction therapists might be looking for when you combine it with the amphetamines. So I think just to deal with some practical tips on that. Yeah, and the other thing is, we know in the world of sex addiction, but if we think about these fantasies, it's almost the same as ingesting a drug or acting on the behavior. It keeps that thing alive, and a lot of my work is what we had mentioned before, where it's easy to kind of be absent from the drugs, but we have to learn how to kind of keep those to one side, but incorporate healthy sex back into our lives, and to do that without triggering the whole system again, where people can really kind of be triggered to use drugs or act out, or the reverse, if they're using porn, or to be triggered in all the other behaviors kind of cascading off that shelf. Those kind of just practical techniques, I think, is clinical skills I'm going to look for. And the other thing, just other things too, I kind of get into a little bit of the weeds when I'm talking to a professional audience. For example, with Chem Sex, we know from a lot of research, and this is true in sex addiction as well, that heightened visual stimulation, right? We get really hyper acute to visual triggers. But with a lot of Chem Sex, we have the corresponding decrease in verbal memory, where people get more fuzzy thinking. It's a whole different set of cognitive challenges that, for example, you might want to think twice about doing cognitive behavioral therapy early on, because it's going to be a frustrating experience for those, especially the amphetamine clients their brains aren't quite working normally yet. So things like that, just tips for working with some of these clients where you have this co-occurring use.
Absolutely.
Just kind of sharing my experience.
Superb. Thrilled. You've got one guaranteed audience number,
Okay.
right? Sitting and talking.
Check one off. Okay, cool.
Well, I mean, I for some weird reason, even though I've indulged in some tragically damaging sexual practices in my active addiction and years of it, I never got into drugs. So this is fascinating to me because some of my clients have done.
Right, of
and
course.
So to come to your presentation and get a better heads up on what to look for, and also I refer when I feel that I'm out of my depth. So to know what to refer, why to refer,
Exactly.
your thing will answer a lot of questions for me. So I'm very much looking forward to it.
Excellent. Great. I'm very excited about the ability and the invitation to speak.
Well, we're thrilled to have you. And David, look, one final question. Would you like to tell our audience of anything you might be doing before October, or just a simple plug for your own website?
Yes. First of all, if people don't know my book, Lust, Men, and Meth, A Gay Man's Guide to Sex and Recovery, which is kind of I'm proud to say, kind of the go-to book for that area among gay men who have sex with men. I'll be presenting at the West Coast Symposium on Addictive Disorders in a few months.
Fantastic.
I'm very excited. I'm working with ITAP to create a program for LGBTQ kind of cultural competency, if you will. It's not only for sex therapists, but it's going to be open to teachers, first responders, anybody that might need some extra training, and just because it's getting very confusing now, the gender terminology and different behaviors. And we are going to cover a lot of some of the history and some of the clinical issues that are involved. So there's two mods. One is a kind of introductory. The second is more of a clinical. And that first mod will happen in September, just before the SASH conference. So there's more info at the ITAP website, but I'm very proud to be part of that.
Well, David, you should be. You're a busy boy.
Yes.
Fantastic.
Yeah.
Your subject matter is so needed and necessary. I thank you enormously. You've piqued my curiosity as a sex addict in recovery, and I much look forward to seeing you and welcoming you to our conference.
Thank you. Can't wait to be there. Thank you.
Listen, keep safe till then. I'll see you in October. God bless for now.
Take care.
Bye-bye.